People worked together in ways that we always talked about and hoped would happen, and necessity caused them to actually do it and see how valuable it was.
The pandemic has helped me to see just how important a support system really is for not only myself in those times, but also for patients.
Moving science forward now requires all of us helping each other to stay active, to stay focused, to coordinate the different pieces that we need in our daily research lives to solve the important biomedical questions that we're addressing.
I think in terms of coming out better than we were before, the ability to communicate with patients virtually, the ability to educate our medical students, our residents, and even our colleagues in medicine virtually. We were always kind of heading in that direction, but this really pushed us way down the line.
The pandemic really changed society as a whole, especially when it comes to innovation. For example, take the vaccine distribution. People needed to be ready to change and adapt and be willing to fill any roles to help the process.
The whole world has been changed. It has really forced society to look at our lifestyles and make choices of what is safe, what is efficient, and what is effective. Fortunately, we've been able to do that quite well. I think the world on the backside of this virus is going to be a totally different place than it was on the front side.
People now know we can work together, and it is good, and nobody's giving up power. Everybody's just working for the greater good of the patient. And those are lessons that were so hard. How do we convince people? Well, this awful pandemic has taught us some very good lessons.
The pandemic has shown how critical it is for healthcare providers to build a foundation of trust, not just on the individual level between a patient and a provider, but also between leaders in medicine and the general public on a larger scale.
All the traditional silos of academia, of pharma, of government, all of that has been broken down, and we are literally working under a common umbrella. And I hope that this continues, because I think this is disease management for the future. This is where American science and global science can really shine if we embrace this approach that we really need to collaborate and we need to have a common goal, and let's strive to work together to get there.